Hi, my name is Joshua Kirian, and I am the Chief Operating Officer and co-founder of Care for Them. And thank you for watching Care for Them's COVID-19 video series. Today, we'll be talking about social distancing. So let's begin. So, what is social distancing? Well, social distancing is actually physical distancing, and it's used synonymously. So usually when you practice social distancing, you stand 6 feet apart from another person, which is about 2 arms length away. It can also be used as a way of saying to stay home. So instead of going in person to work or school and like communicating to people face to face, you stay at home and use applications like Zoom or Google Meets to talk with your coworkers and friends. And it also you can practice social distancing, but you also have to wear masks. It's not like one option or the other. You have to do both. And I'll tell you why. So, is this person wearing this mask the right way? No, he's not actually. This is the right way. See, you have to wear the mask and let it cover your entire nose, mouth, and there can't be any openings around here. It has to secure the bridge of your nose, it has to go around your ear, and there can't be any openings. At the bottom left, we see her nose is protruding out, and it's just bad because it's defeating the whole purpose of the mask. You're allowing the virus to get inside your nose, and if you're asymptomatic or if you're carrying the virus, it can come out of your nose and expose others in your vicinity. You can see that there's a hole in the middle picture at the bottom over here, and that's equally as bad because the virus can come out of your mouth and escape from the sides and from your nose. And yet again, at the bottom, you can see that if you keep it too high, you can have these little openings at the sides of your mask and at the bottom as well. So always try to keep it over your nose, your mouth, and keep it tight. So why? Well, COVID-19 spreads quicker in dense crowds of people. If an infected person coughs, sneezes, or talks, and droplets from their mouth and nose are launched into the air, and it can land into the mouths and noses of people nearby. These droplets can be inhaled into another person's lungs, and the virus can live on objects for many hours. So by social distancing, you're limiting yourself by contacting these everyday objects like doorknobs, toilets, and like public restrooms, etc. And overall, this can, in fact, help flatten the curve. Now, what does flatten the curve mean? As you can see from this graph from the University of Michigan Medical School, flattening the curve basically means if people were to not social distance and were to go about their everyday lives, you would see a huge number of cases of coronavirus positive tested cases. And now if you compare that graph, I guess that bell curve, and you compare it to a different graph where people are actively participating in social distancing and taking these preventative measures such as wearing masks and like staying at home, you would see that a lot fewer number of people will be tested positive, and that would in fact help hospitals get not reach their full capacity and help COVID-19 patients and regular patients at the same time. So that would in fact help flatten the curve, and not a lot of people at the same time will be infected. So basically, the more you practice social distancing, the better it would be for people to go out and effectively go out and enjoy themselves in the long run. So you have to watch for symptoms, and these symptoms are straight from the CDC website. So people with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. And symptoms may appear 2 to 14 days after exposure to the virus. And people with these symptoms may have COVID-19. So these are fevers, chills, coughs, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, the new losses of taste or smell, a sore throat, congestion or runny nose, nausea or vomiting or diarrhea. And this list does not include all positive symptoms, and the CDC will continue to update this list as we learn more about COVID-19. because as we all know, COVID-19 is a relatively new coronavirus, and we just got to know about it recently. It's been like 8 months, but there's still been a lot of research being done on the virus. And now for emergency symptoms. So when you see these symptoms, you should call for medical attention. So trouble breathing, persistent pain or pressure in the chest, new confusion, the inability to wake or stay awake, bluish lips or face, and there may be more. We don't know because this is, again, a new virus and we're still learning more about it. And if you do see these symptoms, you should call 911 or call ahead to your local emergency facility. Notify the operator that you're seeking care for someone who has or may have had COVID-19. Now, of course, as we saw earlier in this slide, these symptoms may appear 2 to 14 days after exposure to the virus. So what does that mean? That means that someone can have the virus, but say it's asymptomatic, which means that you may not be showing the symptoms, but you effectively are carrying the virus. And this can be very tricky because people may assume, hey, this guy doesn't have the coronavirus, he doesn't look like he's sick, I can just go and talk to him face to face and take off my mask. Well, what you don't know is that he might be carrying the virus, but he just doesn't show the symptoms. So after a few days he might get it, or he may not get it at all, but he might be just carrying it and he might pass it on to you. And you would realize until you're too late, either by passing it on to someone else or just getting sick. And yeah, so this is why we should practice social distancing, because asymptomatic conditions can just mess everything up. So yeah. And these are all the sites I used for this, and thank you for watching this short video on proper social distancing.